All right, here we go. Lunchtime Live, February 15th. Hope everybody had a great Hallmark holiday. and we are Regenerative Sports Spine and Spa. I am Daniel Trivia alongside Dr. C here. And today we're going to go into a little discussion on kind of a different level of back pain. And a common thing that I think gets thrown around a lot, which is degenerative disc disease, which in my professional opinion, is kind of like a catch-all phrase. What do you think, Doc?
Absolutely. It's like there's a lot involved in degenerative disc disease, and that's, lots of people have that and don't necessarily have pain from it. So it's one of those that's, if you don't know what else to say, you kind of say, oh, well, you have degenerative disc disease and that's why you hurt.
Yeah, and it's pretty much, somebody took an X-ray and saw that there was less space, right, in between the two bones in your back, the two vertebrae. They saw a little less cushion there, and so they determined that that's degenerative disc disease. Is that pretty much kind of the way it goes?
Pretty much. I mean, it's less cushion and less space, but also less fluid that you can pretty much, it's like the space you can see on the X-rays, but the fluid you would have an MRI. You have to have an MRI to see. So, yeah.
Right. So what is it about, and that the word disease to me is a problem, because I've, as a therapist, I've had people come to me and be like, well, I have degenerative discs. Like, what are you going to do about the degenerative disc disease that I have? And I think it's like a misnomer that people often hear degenerative disc disease, and they think that they have this progressive type of disease in their discs, because that's not really what it is, right?
No, it's not like a progressive disease like the systemic diseases that you hear about. It is progressive, or can be progressive, let me put it that way, with progressive loss of fluid over time, but this is many, many years. So with that, with the loss of fluid, like we was talking about, if let's say you start out with, this much space, trying to get a space where you can see, and then you end up slowly over time, over a few years to 10, 20 years, maybe this much space on the disc. So, but the problem is when you start losing space on the disc, you also put more and more stress on the small joints, the facet joints in the back of the spine. Daniel, are you able to pull up that picture that you have?
I can show it from my phone, but it's on the actual
invitation. Okay.
Yeah, well, not the invitation, but it's on the actual live post here. So, but I can pull it up so we can look at it. So yeah, so if I hold this up, you can kind of see the discs that are bright and white next to the blue arrow. Those are normal discs. The ones down here that you see towards the bottom that have a little less white and a lot more dark around them, those are what we consider to be quote unquote degenerative discs. And people who have really bad degenerative discs, there's really no white there whatsoever. It's black all the way across, right? There's no fluid there. The white that you see is the fluid that shows up on an MRI, versus the black, it would be a less amount of fluid.
Correct.
So, yeah. So, and if we were to, let's say we were to take an X-ray of everybody's back, what percentage of those people would have some sort of degenerative disc?
Probably at least 80%.
Right.
I'm sure you take a picture of mine, I would have it too. So
yeah. And so degenerative discs are kind of I would say, a normal progression of life based upon activity level or how much you sit. If you've had prior accidents, prior issues with back pain, little things like that can all contribute to degenerative discs. So what we're saying is that the natural progression of disc degeneration just kind of happens throughout life based upon activity. So when somebody tells you, oh, you have degenerative discs, we feel like there shouldn't be that much weight put into that particular diagnosis, correct?
Correct. Yes. So it's definitely a common thing.
Right. But if you do have pure degenerative discs that are causing pain, what are the symptoms that typically looks like?
Well, it can be with degenerative discs. If you have that, I mean, you can have both disc and joint pain from it, the small joints in the back, the facet joints. So it can look like, you have pain with sitting prolonged, or you can have pain with standing and walking for a prolonged amount of time. So it's typically a combination of both, because it's not really because of, let's say, the most common thing that people complain about is, oh, I have a herniated disc and that's why I have pain, but that's not what this is. And so you can have this, what we call discogenic pain, but you can also have the facet mediated pain. So it's like certain activities like twisting, things like that can cause more stress on the facet joints. So it's really just an all around generalized back pain that's not specific to necessarily any one particular activity.
Got it. Yeah, and from the rehab guy perspective, what I typically see is people who have pure degenerative discs. Purely, that's the problem, is that they want to be sitting or laying. They do not want to be upright or walking, and that's just because of the position that you're in when you're standing and walking. Where the nerves are as they exit the back, you close down that space and it can pinch and cause sciatica, if you will, pain, tingling down the legs. So that's why you see like the little old ladies that walk through the store, they're like this, because they're bent over. A lot of times, if they stand all the way up straight, it causes pain, right? So that's a typical symptom of pure degenerative disc disease. So if you have degenerative discs, what is the typical treatment process for people with degenerative discs?
So, what we try to do is, number one, make sure that that's really where your pain is coming from, because as you saw on the MRI, there's discs that are losing fluid. We don't know if that's exactly where your pain is coming from, or the facet joint. So what we typically do is called a medial branch block, which is just blocking the nerves that go to the facet joints and seeing how much of the pain gets better. So that would be the first step, just to kind of make sure that we have the correct diagnosis. Because the back is a tough thing. You can have pain from multiple areas. So we want to make sure we have the right diagnosis. So we do the medial branch block. Some people do facet joint injections. I typically don't like to do those because, number one, they don't last very long because they're typically with steroids. And as we talked about last week, steroids only give you temporary relief and actually cause more damage than good over time. So then we just do a block with numbing medicine, just make sure we have the right diagnosis. So that would be step one. Step two can be if we do what's called a radiofrequency nerve ablation. Big word for basically cauterizing the small nerves that go to just the joints. And then that can last for a year to year and a half to 2 years. And that's typically covered under insurance if that's the issue. Now, if we're talking about more long-term benefits, we like to talk about regenerative medicine. Platelet-rich plasma oftentimes isn't quite strong enough for the spine. So we typically recommend bone marrow stem cell to try and help with, as the small joints have little cartilage just like the big joints do. So we try to regenerate as much of that as possible, or it's like give it as much
The opportunity to do so.
The opportunity, exactly. So
right.
To do so as much as possible to give them a little bit more cushion. And then we kind of go from there.
Okay. So is there if we're going to do like regenerative medicine or like a bone marrow procedure into a disc that is obviously less in height, is there a chance that will help, that the procedure will actually increase the disc height and give people more long-term gains?
So that's debatable still right now. There hasn't been any great studies that show that it increases the disc height. However, what we see is that it can prevent further degeneration. So it kind of stays at that stagnant level when we inject. But we've also seen that these discs actually start having more fluid in them after doing the stem cell. So we know that there's some fluid that's being more retained. And you can imagine, even if the disc height does improve, it's a minuscule amount. You won't be able to see it on x-rays or MRI, but enough to where it can make a difference even minutely internally. So so we can't really say that it increases the disc height, but it can prevent further degeneration over time and also improve fluid, which obviously is the health of the disc that you're trying to improve.
Right. And then is that is this a one and done type of procedure? Is this something that people would need to repeat depending upon the level of degeneration?
Well, most of the time we do one bone marrow stem cell and people get a significant amount of relief, whether that be 60% or 95%. Everyone's a little bit different. But there are some people that may need what we call booster injections with platelet-rich plasma. Once you have a better base with the bone marrow stem cell, you can do a better job with the platelet-rich plasma. If you just do the platelet-rich plasma initially, it's probably not strong enough, like we talked about earlier.
Mm-hmm.
But obviously you got to think about over time, we start wearing and tearing our backs even more. So maybe I don't know, maybe 10 years down the line, you may need a repeat. Who knows? We're still in the midst of studying all of that and seeing what the best course of action for treatment times and length of time in between and
Yeah.
all of those kind of things.
So what if, what is there a limit to the amount of degeneration to where you can actually still get in there and benefit the disc?
So, yes and no. So we get to the point where, it's like if you're pretty flat in the disc, I've actually still injected quite degenerated discs with the stem cell. And even if you don't really get that much improvement in the actual disc itself, most of those patients still get quite a bit of pain improvement. And I
Right.
think the reason is because you got to remember that the vertebrae, the bones around where the disc is, are also inflamed from that constant stress you have from the wear and tear. So theoretically, you can decrease the inflammation of the bones and help that a little bit more, and that's a pain generator as well,
Mm.
and as well as the disc and the epidural space. So you have a lot of different things that you're actually treating there. It's not just that degenerative disc. So that's the good part.
Gotcha. And then, outside of, doing, potential steroids or radio frequencies or regenerative medicine, people will tend to have surgery for this, right? So if it's bad enough and there's no disc height space left there, then we're staring at a fusion, correct?
Yeah, typically they put a spacer to increase the height, and then and they have to do a fusion with that.
Yep. And then you risk there's a potential risk of causing degeneration of the discs above and below that area, correct?
Yeah, typically if you're going to fuse one area, and the disc above and below the area that you fuse are going to take a lot more stress, and then a few years down the line, you'll have the same issue at those discs, and then you're looking at the same problem again.
Right.
So
So would you recommend somebody who's had a fusion therapy to do regular checkups on the discs around that fusion to make sure they don't degenerate? And if they do, what would be the best proactive type of response there? We know that most people go to the doctor only when they have problems. People aren't proactive unless it's their yearly physical, which my insurance covers. So what's your recommendation for being proactive for those people who've had a surgery and are looking to protect the discs around there?
well, as we have talked about in the past, but maybe we have a new audience. We can do the stem cells also preventatively. So if you're looking at the discs and you start seeing some fluid loss in the above and below discs, that would be the time to actually consider doing a bone marrow and injecting into the disc to prevent further wear and tear as much as we can, obviously.
Mm-hmm.
So that would be a good time to do it so that you don't end up in the same position where the discs are flattened out and you absolutely need surgery to get some of that pain better. So we want to think about preventative treatments as well. And this would be the time to do it before it becomes essential to have something invasive done.
Right.
Well, more invasive than needles, I'll say.
Yeah. So, how important is the physical rehabilitation part of degenerative discs?
Oh, absolutely. It's like you have to do the exercises that help strengthen that area, stabilize all of those types of things you learn in physical therapy. Because as much as I want to be able to do everything and then you're 100% better, it doesn't really work that way because you have mechanical imbalances that you have internally and muscularly that need to be corrected
Right.
because we all do a pretty terrible job of taking care of our backs in our lives. Do prolonged sitting, and then getting up and doing like bursts of exercise that we're not really ready for, all of those types of things we have to think about. And we do have to do maintenance exercises, regardless whether you do bone marrow, whether you do surgery, whether you do nothing. It's like even with just degenerative disc, that is not that bad. The exercise is essential to help with keeping that from getting worse as well.
Yeah.
So it is definitely one of the most important things that I think a lot of people miss when they come in.
Yeah, absolutely. And I think a lot of people too are just look to get into exercise routines and stay healthy and don't take the time to really understand who the best person is for them to work with on a regular basis to maintain good, healthy backs, right? tend to, just trust somebody who says, oh, I'm a personal trainer, rather than really diving into, do we have an exercise prescription or somebody with an exercise, like a corrective exercise background, something like that, to where we can work on strengthening and support. And people think that, oh, I just need to work on my core strength. I got news for you. Your core strength has zero zip, nothing to do with your 6-pack, 8-pack, 2-pack of abs. Okay. Core strength is more of a deeper type of issue when it comes to supporting the spine. So anybody who tells you to work on your core strength needs to reevaluate what they're telling you, because it's not just about your 6-pack or your back muscles. It's about those deeper muscles that support the spine there. So, so for those of you who have degenerative discs, your discs are suffering, and it could be from lifestyle, it could be from prolonged sitting, it could be from injuries, it could be from a lot of different things. And so when you hear this, oh, you have degenerative discs, make sure you do your due diligence to find out, well, what does that mean and what are the best treatment options for you? As typically it's not steroids, it's not going to be surgery. It's going to be things similar to what we talked about today, which was PRP, regenerative medicine, and stem cell therapy that can actually help create more support to that disc that's degenerating. So, Doc, anything else on degenerative discs today?
Well, I mean, just a comment, if you have multi-level degenerative discs, it's unlikely that a surgeon would recommend surgery anyway, because, it's like if it's multi-levels, it's not something that you go to. So definitely look at the other options as treatment options, and we can definitely treat multiple discs other ways. So yeah, keep that in mind.
Okay. Awesome. Very good. Well, thanks everyone for joining us. Those who popped in, stayed for a little bit. And if you're watching this after the live, go ahead and comment if you have questions about degenerative discs and how they might be affecting your life. We'd be happy to answer those questions for you. And as always, we'll be back on Monday for another lunchtime live. Hope everybody's enjoying their President's Day. And we look forward to seeing you guys next week.
Thank you, Daniel.
All right. Take care, Doc.